Hi, everyone. I'm Dr. Michael Richman, a double board certified cardiothoracic surgeon. So, since Ozempic, you notice semaglutide, which is the GLP-1 receptor agonist peptide that was approved by the FDA for the treatment of type 2 diabetes in 2017. The indications for use have continued to expand. It's currently also approved to reduce the risk of cardiovascular events, which are the number one killer of men and women in the United States, and worsening kidney disease in certain patients with type 2 diabetes. However, alopecia, which is hair loss, has been reported recently as a post marketing adverse reaction in patients receiving Ozempic, although it was not indicated or identified in the controlled clinical trials that got it FDA approved. The current prescribing information lists alopecia among the skin and subcutaneous tissue adverse reactions reported during this post approval use of Ozempic. And because these reactions are reported voluntarily from a population of uncertain size, it's not possible to reliably estimate their frequency or definitively establish a causal relationship to the drug, because hair loss was not among the common adverse reactions. And in order to be reported, it has to occur in greater than or equal to 5% of patients in the clinical trials. And what was documented were the side effects that were GI related, and that was nausea, vomiting, and diarrhea. Now, the mechanism by which semaglutide might contribute to hair loss is not well characterized in the medical literature, though it is felt that the rapid weight loss itself, which is a secondary effect of using GLP-1 receptor agonists, can trigger something called telogen effluvium, which is the temporary thinning or shedding of hair related to this rapid weight loss, and its use is independent of the medication. So now you're asking yourself, what should you do if you're using Ozempic for the indicated conditions and experience hair loss? Well, the first thing you should do is you should be evaluated for other potential causes. And that includes nutritional deficiencies, particularly protein, iron, and zinc, thyroid dysfunction, and also the physiologic stress of rapid weight loss. So, once again, there is no evidence of causality. It's just been seen as a post marketing event, and it occurs in very few patients. So, with that, hope you learned something today. Thank you so much for listening. For more information, guidance, advocacy, or consultation, you can go to my website at www.paladinmds.com. And I hope you have a great night.